Does gabapentin cause memory loss? Memory loss is a common side effect of many medications, including gabapentin. It can come on suddenly and can be very disruptive to everyday life. It is important to understand the potential risks of taking gabapentin, and this guide will provide information on the effects of gabapentin on memory, as well as possible alternatives to consider. Gabapentin is often prescribed to treat seizure disorders, neuropathic pain, and some psychiatric conditions. Although it may be effective in treating these issues, it can also cause serious cognitive issues such as memory loss. In this guide, we will discuss what research says about the link between gabapentin and memory loss, how it affects people of different ages, and what alternatives to consider if memory loss is a concern. By understanding the potential hazards of taking gabapentin, individuals can make an informed decision about their treatment options. Understanding memory loss. When we think of memory loss, we typically think of forgetfulness or a decline in mental sharpness. But memory is an incredibly complex process. It starts with your senses taking in information, which the brain stores as memories. For instance, when you smell a familiar scent, it can bring back memories of a particular event in your life. Memory loss can occur for many reasons, from age-related memory decline to certain medical conditions or medications. It can also be caused by stress, trauma, lifestyle choices, poor nutrition, or vitamin deficiencies. In some cases, memory loss is reversible, while in others, it can be permanent. It's important to understand how memory works and the various causes of memory loss, so that you can take steps to protect or improve your memory. Overview of gabapentin. Gabapentin is an anticonvulsant medication used for the treatment of certain neurological conditions. It is primarily used to treat seizures, nerve pain, and restless leg syndrome. Gabapentin is also sometimes prescribed to help manage anxiety and certain mental health disorders. Gabapentin generally has mild side effects in short-term use, but the long-term use of this drug has been linked to more serious side effects, including memory loss and cognitive impairments. This has raised questions about the safety of gabapentin use and whether it can cause memory problems. Some of the common side effects associated with taking gabapentin include nausea, dizziness, drowsiness, blurred vision, and difficulty concentrating. Other rare side effects include swelling of the face or extremities, abdominal pain, and extreme fatigue. What does research say? For years, the medical community has been researching to understand if gabapentin could cause memory loss and other cognitive impairments. A number of studies have looked at the effects of gabapentin on memory and cognition. The results of these studies show a correlation between long-term gabapentin use and an increased risk of memory loss and cognitive decline. One study showed that people who were taking gabapentin for more than 2 months had a significantly higher risk of developing memory problems than those who did not take the drug. In addition, researchers have found that gabapentin use has been associated with impaired decision-making and executive function. Furthermore, some research indicates that gabapentin may contribute to a decrease in overall brain health. A study published in the British Medical Journal showed that the use of gabapentin was associated with a decreased gray matter volume. This suggests that prolonged use of gabapentin may lead to a decline in overall brain health. Overall, the research is clear. While gabapentin has many benefits, it can also pose a threat to your memory and cognitive function if used for an extended period of time. Therefore, it is important to be aware of how gabapentin can affect your memory and cognition before taking it. Moreover, if you experience any memory problems or cognitive impairments while taking gabapentin, it is important to consult a doctor as soon as possible. Effects on different ages. It is important to understand how memory loss can be affected by age when considering the side effects of gabapentin. Memory loss can be more serious in older people who already may experience natural age-related declines in cognitive functioning. It is also possible for children and young adults to experience memory loss because of gabapentin, although this will differ from age to age. A study published in 2020 found that patients aged 12, 22 who took gabapentin experienced short-term memory loss in the form of difficulty in remembering new information. However, those aged 23, 65, were more likely to experience long-term memory loss, including difficulty in recalling previously learned information. It is important to be aware of potential age-related variations in memory loss caused by gabapentin, as it is essential to understand how it could affect different people differently. Memory loss in younger people may manifest itself in difficulty completing tasks and remembering events, whilst in older people it could be more serious, manifesting in more significant impairments in cognitive functioning. How to cope with memory loss caused by gabapentin. Memory loss caused by gabapentin is a troubling condition that can have significant impact on your everyday activities. Fortunately, there are ways to cope with memory loss so it doesn't interfere with your quality of life. Here are a few ways to help manage memory loss caused by gabapentin. Check for drug interactions. If you are experiencing memory loss while taking gabapentin, the first thing to do is to check for potential drug interactions. Talk to your doctor about any other medications you are taking and discuss whether they are known to have negative interactions with gabapentin. Your doctor may suggest switching to a different medication or lowering your dosage of gabapentin, which can help reduce the risk of memory loss. Keep track of important information. Since memory loss can make it difficult to remember important information, it's helpful to keep track of things like appointments, tasks, and important phone numbers. Use a paper calendar or electronic reminders to keep track of upcoming events, write down important phone numbers and addresses, and keep a list of tasks that need to be done. Breaking down tasks into small chunks can also help you stay focused on completing them. Try cognitive exercises. Cognitive exercises can strengthen your memory and help you cope with memory loss. Puzzles, games, and reading can help keep your mind active and sharp. There are also online memory exercises and apps that can help you practice and strengthen your memory. Talk to your doctor about what types of cognitive exercises would be best for you. Stay organized. Organization can help you stay focused and on top of things. Create an organized system for storing important documents and records, and regularly review and update it. Make sure to also tidy up your work and home spaces to prevent clutter from piling up. Communicate with loved ones. Finally, talking to your loved ones can help you cope with memory loss. Communicating with them about your struggles can provide support and understanding, as well as helpful tips for managing memory problems. Don't hesitate to ask for help when needed. Having someone to remind you of important information or tasks can be a big help. Alternatives to gabapentin. When managing medical conditions, patients may find that gabapentin is not the best option for them. There are several alternatives available to consider. Some of these include acetaminophen, an over-the-counter pain relief medication used to treat mild to moderate pain; ibuprofen, a non-steroidal anti-inflammatory drug, commonly used to treat inflammation and pain; tricyclic antidepressants, such as amitriptyline or nortriptyline, they can help ease nerve pain; anticonvulsants, drugs that can be used to control seizures. Some types are also effective at treating nerve pain; opioids, medications that are effective for treating severe pain but can be habit-forming; cognitive behavioral therapy, CBT, a type of psychotherapy that can help people learn to manage their pain. It is important to note that each of these treatments have their own risks and benefits. It is best to talk to your doctor about which option is right for you. When to see a doctor. If you think that you are experiencing memory problems due to gabapentin, it is important to seek professional help from your doctor. Although gabapentin can be an effective treatment for certain medical conditions, the long-term use of this medication can have serious side effects that require medical attention. Some signs of significant memory loss from gabapentin use include forgetting conversations or instructions that you were recently given, repeating yourself often, needing reminders to complete tasks, difficulty staying organized and keeping track of items, trouble understanding and retaining information. If you are experiencing any of these symptoms, it is important to speak with your doctor as soon as possible. Your doctor will be able to assess your individual situation and determine the best course of action. In some cases, your doctor may suggest reducing your dosage or switching to an alternative treatment option. It is also important to keep track of any changes to your memory or cognitive function over time. Keeping a journal can help you document any changes, and it can also provide valuable information to your doctor about how your symptoms have progressed. Overall, it is important to keep an eye out for any changes in your memory or cognition while taking gabapentin. If you think you are experiencing any serious side effects, be sure to contact your doctor right away. In conclusion, gabapentin is an effective medication used to treat certain medical conditions. However, it is important to be aware of the potential risks associated with it, which include memory loss and cognitive impairments. While research does suggest that long-term use of gabapentin can lead to memory loss, it is unclear whether this applies to all individuals or only certain subsets of the population. Additionally, age-related differences may exist in the experiences of memory loss caused by gabapentin use. To cope with any memory loss resulting from gabapentin, it is suggested to seek professional help to develop strategies and collaboratively explore alternative treatments. Ultimately, understanding the potential risks of gabapentin treatment is necessary for informed decisions about medications and overall health. Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.